Hi and welcome to this presentation, which will focus on SNOMED CT subsets, including their clinical usage and development. This presentation will cover the background for the use of SNOMED CT subsets, including how they relate to the customization of SNOMED CT, why they are used, how to create them, what are the different types available, and lastly, some information about SNOMED International process in this area, as well as some practical advice. An important part of SNOMED CT implementation is the ability to customize. One of SNOMED CT's main strengths comes from the broad scope of its content coverage. However, this can bring challenges. Customization allows a group of concepts or descriptions to be identified based on a specific requirement or use case. This is often done at the local level, but there are also clear cases where this approach can also benefit national and international implementation requirements. In SNOMED CT, the standard way of distributing most types of SNOMED CT derivatives is through the use of the reference set mechanism and creating what we call a derivative, which is essentially an add-on. This allows for the identification of specific concepts or descriptions and also supports a history mechanism to provide an audit trail of the changes over time. For example, when a concept is removed from a reference set. Reference sets represent subsets of SNOMED CT content for specific use cases. For example, the terms that are required at a specific regional level. It is important to point out that a subset can only include content that is included in a specific release. In this way, each subset is defined using the reference set specification and is aligned to a specific release of SNOMED CT to ensure that the users of the subset have access to all the required concepts. Subsets are always based on a clear set of requirements. This is important both in the creation, but equally so in its maintenance over time, to ensure that the subset continues to meet the requirements for which it was built. A very simple example for implementation purposes is to consider a clinician working in a cardiology clinic. For their normal work, they only require concepts related to cardiology, and these may be diagnoses, procedures, or clinical findings. A subset can provide a solution to this by providing a constrained list of concepts, which in turn can enable faster and more relevant data entry. However, the use of a subset in an EHR does not preclude the clinician from accessing all of SNOMED CT if this is required. For example, when a patient arrives in the clinic with a diagnosis related to kidney problems. SNOMED CT and the reference set specification provides a number of different ways to specify the list, which includes choosing individual concepts or specifying the list through the use of a query leveraging the hierarchies within SNOMED CT. The choice of the method of creation has an impact on the development of the subset, and more importantly, on the maintenance of the subset. Developing subsets always involves viewing and understanding the content in a SNOMED CT release. In most cases, this will involve utilizing a SNOMED CT browser. However, there are a few practical tips before you start. Most importantly is to avoid using a browser to search blindly. For example, do not assume that to create a cardiology subset, that this simply requires searching for cardio and heart, because this will very likely return results from hierarchies which may not be relevant to your requirements. Before you begin your search, start by documenting and refining a clear set of requirements. This may include using existing source materials, such as existing record content, assessment scales, nursing care plans, and other healthcare requirements. Once the requirements have been clearly defined, SNOMED CT can be searched in an efficient manner using filters as needed to identify appropriate content. Information on how to use the browser effectively is provided in another presentation. At an international level, SNOMED International has developed some internationally valid subsets based on international requirements. These have been created by subject matter experts and are often done in collaboration with international professional organizations. Currently, these subsets include ones focused on dentistry, primary care, and nursing. In the future, there will likely be additional subsets as requirements are expressed and documented. So far, we have focused on the international view of subsets. However, it's important to point out that many SNOMED International members have national extensions of SNOMED CT, and as part of their national release, they also publish and maintain national subsets. These are created and maintained to meet national requirements. For example, often these subsets are created to meet national reporting requirements or to support national standards implementation. The subsets themselves may include content from the international and national releases, and are valid for implementations that use the national extension to which it is associated. These subsets are managed at a national level by national release centers. They are often supplied with detailed implementation guidance to meet the documented requirements for subset usage. Lastly, national subsets are available to other SNOMED International members or licensees for review, and to assist in subset development elsewhere. Below the national level, subsets can also be produced and maintained at a local level to support local requirements. To have the ability to do this, the user or system must have a SNOMED CT namespace to enable the subset to be specified and formally released. This enables the subset to be effectively managed over time and may also allow the local user to specify new content in the local release that is specific to the local requirements and needed for local implementation. However, it is important to emphasize that creating a subset requires a local infrastructure to be in place that can support the ongoing maintenance of the subset, as well as its creation. Examples of local use may include, but are not restricted to, the creation and support of drop-down lists in a local EHR implementation, support for locally defined decision support rules, and the support for locally specified clinical guidelines. What should you do if you have identified the need for a SNOMED CT subset? On this slide, we have provided some considerations. The starting point will always be to understand and document the requirements for the subset. These should include detail of the content, but also a description of how and who will use the subset, as both of these points may have an effect on the content included. There should also be a decision on whether the requirements have local, national, or international validity, as this will have a direct impact on who should be involved in its creation. Finally, and most importantly, who will be the responsible owner of the subset, both in terms of its creation, but also including its longer-term maintenance. This will be based on how the subset will be used. If you identify a requirement for a subset that you feel has international significance, these requirements can either be discussed in a clinical reference group if one is available, or details of the requirement should be shared with SNOMED International by sending an email to info@snomed.org. If you are submitting a requirement, please provide as much detail as possible. This should include documentation, a clear description of how it will be implemented, and links to any supporting information, such as assessment scales. In addition, it is helpful to have clear support from international or national professional bodies. When SNOMED International receives requests for new subsets, each request is reviewed on its own merits and will involve dialogue with the requester. If the decision is made to pursue the request, a project group will be formed and tasked with creating the subset in line with the stated requirements. This includes the identification of SMEs who can provide the required expertise. Resources will be allocated to its creation, which will include external review. Once the subset is created, the project group will be closed. A new or existing editorial group will be tasked with the maintenance of the subset. If you are looking at the requirement for a subset, there is some practical advice available based on our experience. Firstly, decide whether the subset has local, national, or international usage and contact the relevant organization. Does a group of clinicians always need to meet face-to-face? In our experience, there are many cases where video conferencing and discussion forums are as effective as face-to-face meetings. When a face-to-face meeting is required, this is most successfully achieved using an existing clinical meeting or conference, where the maximum number of interested individuals can attend. How big or small can a subset be? The answer is that there is no restriction on size. The only dictating factor is the number of concepts required to meet the documented requirements. Should the concepts be organized in a hierarchical form? The answer goes back to the requirements and may support the use of a terminology query to identify content, or may require the selection of individual concepts. Both approaches are equally valid if dictated by the requirements. How can a group reach consensus on a list of SNOMED CT concepts? Consensus is usually reached through the use of a project group, which will consider the scope for consensus at the beginning of the project. Then there is the question of how long the task will take. This will vary depending on the requirements, the scope of the subset, and the size and complexity of the content included. It can vary from a couple of months or closer to 12 months. Finally, creating an initial list of concepts that can be reviewed is often helpful, as this provides a focus for the project group's discussion. That concludes the presentation. We hope you now have a better understanding of how subsets are used and how you as a clinician can contribute to their development. Thank you for watching, and goodbye for now.